Welcome back to our channel. In today's video, we will be discussing how to lower blood pressure naturally and quickly at home. But before we get into today's video, please take a moment to like, subscribe, and ring the bell so you can be notified of future videos. As most of you already know, high blood pressure, also known as hypertension, is a serious medical condition that can lead to stroke, heart disease, and other health problems. It is estimated that 1 in 3 adults in the United States has high blood pressure. While there are medications that can be used to lower blood pressure, many people prefer to try natural methods first. There are a number of natural ways to lower blood pressure, some of which can work quickly within minutes. Here are some natural ways to lower blood pressure quickly. Acupressure. Acupressure is a traditional Chinese medicine technique that involves applying pressure to specific points on the body. Some studies have shown that acupressure can be effective in lowering blood pressure quickly. For example, one study found that applying pressure to the Taichung acupoint on the foot for 2 minutes lowered systolic blood pressure by an average of 50 mm of mercury and diastolic blood pressure by an average of 4 mm of mercury. Short walk. A short walk can also help to lower blood pressure quickly. One study found that walking for 10 minutes lowered diastolic blood pressure by an average of 5 mm of mercury. Slow breathing. Slow breathing exercises can also help to lower blood pressure quickly. One study found that controlled deep breathing exercises for 10 minutes lowered systolic blood pressure by an average of 5 mm of mercury. Beetroot and apple juice. Drinking beetroot and apple juice can help to lower blood pressure quickly. Beetroot contains nitrates, which the body converts to nitric oxide. Nitric oxide helps to relax blood vessels and lower blood pressure. One study found that drinking a glass of beetroot and apple juice lowered systolic blood pressure by an average of 8 mm of mercury. Pomegranate juice. Pomegranate juice is another beverage that can help to lower blood pressure quickly. Pomegranate juice contains antioxidants that help to protect blood vessels and lower blood pressure. One study found that drinking a glass of pomegranate juice lowered systolic blood pressure by an average of 5 mm of mercury. In addition to the natural ways listed above, there are a number of other things you can do to lower your blood pressure naturally and maintain it. These include eat a healthy diet. Eating a healthy diet is one of the best things you can do for your blood pressure. A healthy diet includes plenty of fruits, vegetables, and whole grains. It also limits processed foods, saturated and trans fats, and sodium. Exercise regularly. Regular exercise is another important part of a healthy lifestyle for people with high blood pressure. Aim for at least 30 minutes of moderate intensity exercise most days of the week. Lose weight if you are overweight or obese. Losing weight can help to lower blood pressure, especially if you are overweight or obese. Manage stress. Stress can raise blood pressure, so it is important to find healthy ways to manage stress, such as exercise, yoga, or meditation. Here are some additional tips for lowering blood pressure naturally. Get enough sleep. Most adults need 7 to 8 hours of sleep per night. Limit alcohol intake. Alcohol can raise blood pressure, so it is important to limit your intake. Quit smoking. Smoking is a major risk factor for high blood pressure. Quitting smoking can help to lower your blood pressure and improve your overall health. There are a number of natural foods and supplements that can help to lower blood pressure. Some of the most effective include garlic. Garlic has been shown to lower blood pressure by relaxing blood vessels and improving blood circulation. Studies show garlic and garlic supplements have shown effectiveness in reducing blood pressure in hypertensive patients, similarly to first-line standard antihypertensive medications. Kyolic or aged garlic has also shown promise in improving cardiovascular health by reducing arterial stiffness, elevated cholesterol levels, and blood stickiness. In addition, the prebiotic properties in garlic increase gut microbial richness and diversity. Omega-3 fatty acids. Omega-3 fatty acids found in fish oil, flaxseed oil, and walnuts can help to lower blood pressure by reducing inflammation and improving blood vessel function. Studies found that the greatest reduction in blood pressure was seen with a dose of 3 grams per day. Taking more than 3 grams per day did not lead to any further reduction in blood pressure. The findings of this study suggest that preventive strategies for reducing cardiovascular risk in the general adult population could be improved by recommending that everyone take 3 grams of omega-3 fatty acids per day. Additionally, people at risk for cardiovascular diseases should be advised to take omega-3 fatty acids as part of their overall treatment plan. Potassium. Potassium is a mineral that helps to regulate blood pressure. Good sources of potassium include bananas, potatoes, spinach, and yogurt. Few physicians actually think about proposing to eat more foods that are high in potassium, fruits, vegetables, nuts, to better control BP. Yet, during the last 40 years, increasing evidence has accumulated demonstrating that increasing potassium intake, either with food products or with supplements, is associated with significant reductions of both systolic and diastolic BP. In addition, several meta-analyses have now confirmed that high potassium intake reduces the risk of stroke by 25%. Calcium. Calcium is another mineral that helps to regulate blood pressure. Good sources of calcium include dairy products, leafy green vegetables, and tofu. When you don't get enough calcium in your diet, your blood pressure may rise. This is because calcium helps to keep blood vessels relaxed and prevents them from narrowing. It also helps to control the amount of fluid in your body. When you don't have enough calcium, your blood vessels may narrow and your blood volume may increase, both of which can lead to high blood pressure. There is a growing evidence from both human and animal studies that a low calcium diet is linked to high blood pressure. Coenzyme Q10. Coenzyme Q10 is a nutrient that helps to produce energy in the cells. It has also been shown to be effective in lowering blood pressure. A review of 12 studies found that taking coenzyme Q10 supplements lowered systolic blood pressure by 17 mm of mercury and diastolic blood pressure by 10 mm of mercury. Coenzyme Q10 may lower blood pressure by improving blood vessel function and reducing inflammation. Vitamin C. Vitamin C is a powerful antioxidant that has been shown to lower blood pressure. A review of 29 studies found that taking 500 mg of vitamin C daily lowered systolic blood pressure by 4 mm of mercury and diastolic blood pressure by 1.5 mm of mercury. Vitamin C may lower blood pressure by increasing nitric oxide production, which relaxes blood vessels. Olive leaf extract. Olive leaf extract is a supplement made from the leaves of the olive tree. It has been shown to lower blood pressure in people with hypertension. A study found that taking 500 mg of olive leaf extract daily for 6 weeks lowered systolic blood pressure by 11 mm of mercury and diastolic blood pressure by 5 mm of mercury. Olive leaf extract may lower blood pressure by increasing nitric oxide production and reducing inflammation. Resveratrol. Resveratrol is a compound found in red grapes, cocoa, and other plants. It has been shown to lower blood pressure in people with hypertension. A study found that taking 200 mg of resveratrol daily for 6 weeks lowered systolic blood pressure by 6 mm of mercury and diastolic blood pressure of 3 mm of mercury. Resveratrol may lower blood pressure by improving blood vessel function and reducing inflammation. In addition to taking supplements, there are other things you can do to lower blood pressure naturally. These include reducing sodium intake. Eating too much sodium can raise blood pressure. Aim to consume no more than 2,300 mg of sodium per day. Quitting smoking. Smoking damages blood vessels and raises blood pressure. Quitting smoking can help to lower blood pressure and improve overall health. Drinking less alcohol. Alcohol can raise blood pressure. Aim to consume no more than 2 drinks per day for men and 1 drink per day for women. Reducing caffeine intake. Caffeine can raise blood pressure in some people. If you have high blood pressure, it is best to limit your caffeine intake. Eating a healthy diet. Eating a healthy diet can help to lower blood pressure. Eat plenty of fruits, vegetables, and whole grains. Limit processed foods, saturated and trans fats, and cholesterol. Exercise regularly. Exercise helps to lower blood pressure. Aim for at least 30 minutes of moderate intensity exercise most days of the week. If you have high blood pressure, it is important to talk to your doctor about the best treatment plan for you. Natural supplements can be effective in lowering blood pressure. Thank you for joining us on today's journey through natural treatments for hypertension. Please remember to like, subscribe, share, and leave us a comment. We look forward to seeing you in our next video. Until next time, stay healthy.